So Amy, now I'm going to go ahead and I'm going to start right in through here on your cheek area, okay?
Okay.
So once again, I'm using my fingers as my guide and the tension. How does that feel? Okay. Is it too much or are you okay?
No, I'm actually okay.
All right, good.
I can tell you're right. It's a little more sensitive, but it's okay.
Good. A lot of people come in and they say, what can I do to get rid of my nasolabial folds, which is the little line right here. This is great in helping to soften it. You can just kind of keep running right over that, just to soften it ever so slightly. Now what I'm also going to do is I'm going to connect this area up here, and I'm going to keep it at the lower intensity because this area tends to be really sensitive also. Now one of the other concerns we had is right here underneath the eye area. The eye area, we're just going to sweep it around, and this is the only time that I will sweep it around and I will pick it up. If you try and sweep it around and then push it back the other direction, the skin folds too much and it sticks. So once again, we've got even crystal flow everywhere. She's turning nice and pink. I'm just going to match everything up. Let's dust her off and see how she looks. She looks good. Now what I want to do is, because I'm going to focus on the nose area and the upper portion of the mouth, the nose, I usually like to tell people I'm going to be moving their nose around a little bit, so they're going to be breathing through their mouth. So excuse me, I'm going to have to squish your nose a little bit so I can get in there. Because most people, that's where they complain of where all their blackheads are. For this area, you can do circular motions, you can do little tiny sweeping motions. I personally just try and scrub as much as possible to really get in there and clean that section out, because that's where we get a lot of congestion right here in the corner. And once again, around the nose and for all over the face, you want to make sure that you have direct contact onto the skin. When you don't have direct contact onto the skin, you lose the crystal flow and you lose the vacuum. Now I'm going to go right above your lip, so I'm going to have you keep your mouth closed for me. This is great for those little lip lines where most people complain that their lipstick bleeds into. So this works phenomenally well for it. This also tells you too, or it also points out why you don't just want to bring in your next client and use the same tip on someone else, because we're going right by the mouth. So you always want to make sure that you change the tip. So we'll dust that off. The brush that I like to use to dust off the crystals, you can get a spray-on antibacterial agent, which will also kill any type of bacteria. I personally just find this very helpful to use instead of actually using gauze. So your nose looks good. It's nice and smooth, cleaned everything out. Good. Now for the chin, I'm going to go ahead and turn it up a little bit, because we were talking about the chin and your congestion. So right now I was at 3/4, so I'm going to turn it back up to about a 4 will be good. And at some point, Amy, I'm going to ask you to make a chin for me. And what that means is I want you to kind of stick your tongue right like so. Perfect. But right now I want you to relax. Okay? The chin is always a little bit trickier because you can't really pull the skin too tautly in through here. You do want to go right up to the lip line though. How does that feel?
Okay.
That's okay? Not too uncomfortable? A lot of people ask, or I get a lot of questions, well, what kind of pattern should I do? I don't understand. Should I go back and forth? Should I do a crisscross pattern? In your owner's manual, there is a face that's in there that does show different ways, or actually it shows a pattern of how you can choose to do your microderm treatment. I personally just find the sweeping motion much easier. I just keep repeating the same area over and over again until I actually get the pinkness that I want.
Yeah. I feel better already.
Okay. Now I'm going to have you go ahead and make a chin for me. Thank you. The reason I'm having you make a chin is we get a lot of little milia and congestion right in through here. And that way it just kind of pooches it out so it's easier to get in there and remove them. And even though I've gone over your chin numerous times, your chin can kind of take it. Okay, go ahead and relax. How you doing so far?
Very good, thank you.
Good. Okay. So I'm going to go ahead and start on the other side of the face. And I'm going to just start right here at your cheekbone area. Is that too much? Or are you okay?
I'm okay.
All right. Now, I'm keeping it at the same level for this area right here because you don't need to necessarily turn it down because this area isn't quite as uncomfortable. If Amy had said though, oh, it's uncomfortable, you want to go ahead and turn it down then. But once again, you want to look to see how the skin is changing, and we can already see that it's turning a nice pink color, which is perfect. We're getting a nice good crystal flow, which is great. So let's see what we got. It's perfect. The other nice thing is too, as you can see that she's turning pink, and if you were to now look at her forehead, it's calmed down considerably. So this is not a treatment where people are going to leave and they're just going to be bright, bright red all over. In some cases, the higher you go, sure, they might, but for someone's first initial treatment, you want to make sure that they leave with some slight erythema color, but not too bad. So now I'm going to turn it down because I'm going to be working in this section, okay? And once again, you just tell me if it's too uncomfortable. You okay?
Mm-hmm.
Okay, good. Sometimes what you'll notice also is one side of the face is going to be more sensitive than the other. Completely normal. Completely normal.
You're right. This side's a little more sensitive.
Yep. The other thing too, you might notice if someone isn't feeling well and they come in for their treatment, they're going to be more sensitive. A lot of people ask, well, can I do waxing in conjunction with microderm? I wouldn't necessarily recommend it because if you think about it, we're going in there and we're really manually scrubbing the skin here, and then by waxing, it's just too traumatic within one visit. So I would separate them if I were you. So this side was more sensitive, huh?
A little bit, yes.
Okay. Perfect. So now what I'm going to do is I'm going to go above your lip over on this side. So I'm going to have you stay right there for me. And I'm just going to stretch it out slightly here. Once again, as you use your machine, I highly recommend that you play with it and figure out what's going to be the best way for you to use it, what's going to be the easiest way for you to use it. That's all I did. It was just kind of messing around with it on myself and on other individuals that were in my office to really get a full feel for it, which is perfectly normal. And like I said, you don't necessarily have to do the sweeping motion that I do. You can change it around if you want to a little bit. You'll all start to get more familiar with the dial, when to turn it up, when to turn it down.